Hello, and you're once more welcome to Auto Talking Lifestyle, where we have our health talk. For today, we are looking at a type of herpes that affects the eyes, and this type is the ocular herpes. Eye herpes, also known as ocular herpes, is a condition of the eye caused by the herpes simplex virus, that is the HSV. The most common type of eye herpes is called epithelial keratitis. It affects the cornea, which is the clear front portion of your eye. In its mild form, eye herpes causes pain, inflammation, redness, tearing of the cornea surface. HSV, as I mentioned earlier, of the deeper middle layers of the cornea known as the stroma, can cause severe damage, leading to vision loss and blindness. Eye herpes is the most common cause of blindness associated with cornea damage and the most common source of contagious blindness. HSV is very contagious. One can get infected with bodily fluids. There's a fluid discharge, that's why it's also contagious when it comes to the eye herpes. Both mild and severe eye herpes can be treated with antiviral medication, and with prompt treatment, HSV can be kept under control and damage to the cornea minimized. Typical symptoms of eye herpes include eye pain, sensitivity to the light, blurry vision, tearing, mucus discharge, red eye, painful, red blistering rash on upper eyelid and one side of forehead. In many cases, herpes affects only one eye. Sensitivity to light, meaning you won't like to be using lights, that's all. When someone turns on a light, you try closing your eyes. With the ocular herpes, we have two types. The one that affects the deeper layer of the cornea known as stromal keratitis, and the one that affects the thin outermost layer called the epithelial keratitis. Causes of ocular herpes. Eye herpes is caused by an HSV transmission to the eyes and eyelids. It's estimated that up to 9% of adults have been exposed to HSV1 by age 50. When it comes to eye herpes, HSV1 affects these parts of the eye. That includes the eyelids, cornea, which has to do with a clear dome on the front of your eye, retina, the light sensing sheet of cells in the back of your eye, conjunctiva, the thin sheet of tissue covering the white part of your eye and the inside of your eyelids. Unlike genital herpes, usually associated with HSV2, eye herpes isn't sexually transmitted. Diagnosing eye herpes. If you have symptoms of eye herpes, see an ophthalmologist or an optometrist. These are both doctors who specialize in eye health. Early treatment may improve your outlook. To diagnose eye herpes, your doctor will ask you detailed questions about your symptoms, including when they started and whether you've experienced similar symptoms in the past. Your doctor will do a thorough eye exam to evaluate your vision, sensitivity to light, and your eye movements. They'll put eye drops on your eyes to dilate. That means to widen the iris. That helps your doctor see the condition of the retina in the back of your eye. With each treatment, if your doctor determines you have eye herpes, you immediately start taking prescription antiviral medication. The treatment differs somewhat depending on whether you have epithelial keratitis, that is the milder form, or stromal keratitis, that's the more damaging form. With the epithelial keratitis treatment, HSV in the surface layer of the cornea usually subsides on its own within a few weeks. If you promptly take antiviral medication, it can help minimize cornea damage and vision loss. Your doctor will recommend antiviral eye drops or ointment or oral antiviral drugs. A common treatment is the oral medication acyclovir or Zovirax. Acyclovir may be a good treatment option because it doesn't come with some of the potential side effects of the eye drops, such as watery eyes or itching. Your doctor may also gently brush the surface of your cornea with a cotton swab after applying numbing drops to remove diseased cells. Stromal keratitis treatment. This type of HSV attacks the deeper middle layers of the cornea called the stroma. Stromal keratitis is more likely to result in corneal scarring and loss of vision. In addition to antiviral therapy, taking steroid, that is anti-inflammatory, eye drops helps reduce swelling on the stroma. Like I said before, we have two types of ocular herpes, so their treatment process won't be the same. And please take notes. Ocular herpes is not curable, so if you have any of these symptoms, please see an optometrist to get your eyes checked before it's too late. You may mistake eye herpes for conjunctivitis, which is known more commonly as pink eye. Both conditions may be caused by a virus, though conjunctivitis can also be caused by allergies, bacteria, and other chemicals. A doctor can make the correct diagnosis using a culture sample. If you have eye herpes, the culture will test positive for type 1 HSV. Receiving a correct diagnosis can help you to receive proper treatment. This is all that we have for you on today's health talk, which we talked about ocular herpes. I believe you have subscribed. Your subscription is very, very essential to us to help us continue with all that we've been granting you on this channel.